Chair, recognize the gentleman from Florida, Mr. Clawson.
Thank you for coming again, guys. And I'm going to ask for some quick answers because I got several questions and I think people are ready to go. Okay? First of all, it's the same mosquito that carries dengue, chikungunya, and Zika much of the time. Is that correct?
That's correct.
And so is anybody thinking about a genetic therapy fix here? I mean, I don't want Frankenstein mosquitoes, but it seems to me that you get the Trojan horse and the soldiers inside the Trojan horse are going to die with it. And so as I thought about my own legislation for this obvious problem being from southern Florida, it seemed to me that genetic fix ought to be something that is thought about. And if you all tell me it's practical, then with my team, I'm going to keep pursuing what we could do legislatively to motivate that. Y'all in agreement with me on that?
It's a promising technology. The biggest challenge is scalability and community acceptance.
Agreed. But multinational companies work all over the world, and that acceptance factor might be different as we get closer to the equator. You would agree with that too, right? In terms of, because you got a bigger outbreak, you got a bigger problem. Okay, thank you for that. We have a vaccination for dengue in Brazil, right?
Correct.
I know they were working on one in Southeast Asia for a long time. I don't remember where it got. Do they go quicker on this sort of thing to get vaccines in Brazil? I mean, would Americans that are worried about dengue fever, should they go to Brazil for a vaccination, or are you all, are y'all hesitant about, the safety of this? I mean, it just seems like the obvious question.
No, actually, that's a good question. There is a approved vaccine by Mexico and Brazil for a dengue vaccine that's about 60+% effective.
And would you get? There's 4 different types of dengue to my.
You are correct.
And is that if you get a vaccine for dengue fever in Mexico, would it work in India? That's a different strain and sometimes a different mosquito.
It's the relative proportion of the serotype that's dominant in a particular area. The one that didn't quite get off the ground in Asia didn't have a good protection against evenly all 4 serotypes. The one that's in Brazil now. And I'm saying that...
Well, so it works better with whatever the mosquito here is and maybe the one adjacent.
Right.
That's closer in the serum, as you say, right?
And we actually have a phase 3 trial that's ongoing that started just about 4 weeks ago in Brazil in collaboration with the Instituto Butantan, that the NIH is actually running the trial with them.
And is anybody working in Asia now so that if somebody gets off a plane during the rainy season, during the monsoon in India, they don't bring a different strain to Mexico or Brazil?
Well, I don't think it's a question of a different strain because you have 4 serotypes that are essentially universally seen all over. So even in India, they'll be all 4. Rather than one strain or the other, it's the one that's dominant, like serotype 2 is one of the most problematic ones.
Got it. Okay. I mean, look, for me, that's a big deal. I've had breakbone fever, and I don't want number 2 and then have a hemorrhagic complication here, guys.
You got it.
And so, as I think through that from my own experience, I say, okay, in a world of international travel, second time's going to be worse. I'm in the 50 and older crowd, right? Which makes me my liver even more susceptible to swelling. So, we also have to think about that global nature of this. Am I right about that, or am I missing the boat here?
You are.
Okay. Do you, my idea, our idea legislatively was, we could always use government money here. It seems to me that as long as, to Mr. Donovan's point, as long as drug companies see a profit motive, and I'm always worried about that in Zika because I've got one of the few districts that might be actually impacted here. It's not going to get impacted in New Hampshire, right? But it could be impacted in my district, Naples. Nonetheless, I mean, if we gave somebody tax credits for their R&D in order to expedite research into, battling this virus or coming up with a vaccine, you see any downside on that? It's trying to accelerate the private sector to to jump in the game here? Because it feels to me like they set out dengue fever. It feels like they're sitting out chikungunya, and we don't want them to sit out Zika. Am I right about all of that?
Incentives to pharmaceutical companies are often helpful in getting them engaged. We have another way to incentivize them, which is what we do at NIH, is that we do what's called de-risking. We do a lot of the work that they would otherwise pay for themselves so that their investment risk is less. Some companies take the vaccine from the concept to the product. They don't need anybody. They don't need the NIH. They don't need anybody. But when something is a public health imperative and they're not interested, if we push the envelope to the point we say, here, we have a product that we know is good, it's safe, and it's immunogenic, they're much more enthusiastic about getting involved because we've already made a major investment. In addition to what you said, which I agree with, that's a good way to incentivize them.
Good. Can I have one more question, Mr. Chairman? One more question. So we always think about these diseases as if they were malaria, which means outdoor, nighttime. You know, these are indoor, daytime mosquitoes. And so spraying, whenever I see the spray trucks, I say, well, that's a wasted bullet. On the other hand, in our country and in my district, we don't have as much water sitting around, fresh water sitting around like you would find in the Caribbean or in Brazil. If we do a good job on making sure we don't have a lot of pooling water around, are we going to be, is that enough? Are we going to be okay until there's a vaccination?
It's really going to depend on the local environment. So how
about Southwest Florida?
Well, this is one of the reasons we need a supplemental, to give resources so we can look at mosquito populations, trap them, analyze them, and then sometimes larviciding can have a very major impact on reducing mosquito populations. Your point is quite correct that the outdoor spraying may have limited impact, if any, on this mosquito population, but we're looking at different ways of doing mosquito control, and in some circumstances, what they've done in Australia, for example, is use targeted indoor residual spraying for this particular mosquito with, as far as we've seen, some pretty effective results. But all of that is quite complex to do.
And let me see if I, just taking off on that point so that I understand it correctly, because again, we want to get in the game here legislatively, so I'm not just asking to take your time here. Like a lot of things, it always impacts the poor and people that, you know, life's never fair. And so, you know, in my house, I have air conditioning. If I see a mosquito inside, I say to myself, it's not chikungunya, it's not Zika, so if I get bit, I don't have to worry about it. But someone else who may not be able to afford that is more at risk. Am I right about that? Do I understand the information correctly?
You are exactly right. And if I
so that should drive some of our policy here as well. I mean, pooling water at my house is not as much of a problem as it's going to be at someone less fortunate. Am I right about economically speaking?
If we look at a study done by CDC doctors and scientists of a dengue outbreak in Brownsville, Matamoros, in South Texas a few years back, the rate of infection was 8 times higher in Matamoros than it was in Brownsville, and the two driving factors for that were air conditioning, reduced people's risk 15-fold, and smaller house plots, which increased crowding and increased risk 7-fold.
Right. And then even if they have AC, they often don't have it in the bathroom where the water is or in the kitchen where the water is. Am I right about that too? So it complicates it. Dr. Mendez, is there anything on my line of questioning that you've heard me say or algo que no estoy diciendo aquí, que no estoy preguntando?
Muchas gracias. You are so knowledgeable, and we discussed this last time when we were talking about dengue. You were almost prescient that clearly this is an area that deserves attention. I just want to report that under the President's Malaria Initiative, we work with the Gates Foundations and many other partners on an integrated vector control consortium. They are interacting with industry. We are looking at new insecticides, new tools. We are now, that effort was focusing on Africa, on malaria, but that capability can be deployed to address this need in the region.
Can I interrupt just one? You're making a great point. I mean, I got bit at 9 in the morning in an auto parts plant that you're never going to air conditioning, right? So the work environment is an area that we've got to keep in mind. I think that's a great point.
And you are correct also that is usually the poor. I mean, it's northeastern section of Brazil, a poorer area, more tropical area. So yes, there are local conditions that make it more likely that you will get the disease. The other point I would like to just mention is, of course, we do have for a while now the Orphan Drug Act that provides some incentives for industry to develop diseases where otherwise market failure will prevent them. So we have some tools, and we have different markets, different diseases, as Dr. Fauci has alluded. We are looking at how we are going to work in that space so that industry is engaged, not only in finally developing these products, but scaling them up, and so that they can reach the poor in particular.
Y'all keep talking. Y'all are great. And, you know, we need to spend some money on this. Real life impact on a lot of people. So thanks for what you're doing. And thanks for being so patient with me here, asking all these questions.